All right, welcome back to ABA Exam Review and the continuation of our RBT Practice Exam series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Be sure to check out btexamreview.com for all of our study materials, including our combo pack. We will be making the transition to the new RBT task list by the time it is out in January. If you're already listening to this in the next year and the task list is out, then you can disregard. But we're going to have a full new task list edition breakdown, questions based on the new editions, and practice exams. So be sure to be on the lookout for all of that coming very soon. Other than that, when you do pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. Your client has successfully learned to greet family members at home by saying hi and waving. However, the parents report that the client does not greet teachers, therapists, or other familiar adults outside the home. You begin practicing greetings with different people in various settings, school, clinics, and park. What strategy are you implementing to address this issue? Starting with a fairly simple question and just staying on the idea of this new task list. Even with the new task list, a few topics may change, but the general terms and things you need to know will stay the same. So you still have to know all of the basics no matter what task list you are using. Now, here we have a client who can greet family members at home. That's great. However, as we know, if we can't get a client to engage in the behavior we want in a natural environment, then we're not really being successful. So if the client is not greeting teachers, therapists, or other adults outside the home, this is not really a success. It's great he's saying hi to family members, but we still need to do the same behavior in the real world. So now you're starting to practice greetings with different people in various settings. What are we trying to do? A, are we trying to teach maintenance? Well, we're not really teaching maintenance, right? Maintenance isn't necessarily taught. You can strengthen skills, but maintenance happens once you teach a skill, stop teaching that skill, and it continues. At this point, the skill is just not happening at all. B, generalization training. Are you trying to teach this individual to generalize? You are. The whole idea is to get them to generalize outside of just their home to teachers, therapists, and other adults. You're engaging in generalization training. And yes, we do try to teach and train generalization. We don't just hope that it happens. C, discrimination training. With discrimination, what are we doing? Well, rather than generalizing skills, we're trying to get someone to tell the difference between items or people or stimuli. Not necessarily here, we're not trying to necessarily get them to discriminate between people they know and they don't, but we just want them to generalize greetings to adults. So it's almost the opposite of trying to discriminate between stimuli, because we want this client to start responding and saying hi to many adults. And then D, shaping. We might be using shaping, but there is no indication based on the information we're given that they are using shaping. It doesn't discuss approximations or terminal behaviors or anything of that nature. Based on this information, based on what we know, the strategy here is going to be generalization training. You're working with a client who frequently grabs items from other people without asking. Your BCBA has developed a functional communication training plan to teach the client to request items appropriately instead of grabbing. The plan specifies teaching the phrase, "Can I have it?" or using a picture card to request. What is the primary goal of this functional communication training? When we think about functional communication training, what are we trying to accomplish? We're trying to get our client or our learner to communicate their wants and needs in a socially valid manner. And when we talk about social validity, we're talking about meaningful, effective, and acceptable behavior. Because whether we like it or not, there are acceptable ways and not acceptable ways to do things and communicate in just a natural setting, right? So that's the whole idea behind functional communication training, helping our clients meet their needs in a socially valid way. So if we have a client who just grabs items from other people, and there's this plan to teach them to request items appropriately with "Can I have it?" or a picture card, well, what's our primary goal of this plan? A, punish the grabbing behavior by requiring extra effort. We're not necessarily punishing the grabbing behavior, right? We're trying to teach a replacement, okay? Because grabbing isn't necessarily a bad thing, But if they're just grabbing items all the time without asking, that can cause some issues in a natural environment. So we're not necessarily punishing a behavior here. B, to teach a socially appropriate replacement behavior. Yes, this is what we just talked about, right? Socially appropriate, socially valid. We want behaviors that are functionally equivalent, meaning they meet the same function, and that are also socially appropriate and socially valid. C, to eliminate all of the client's motivation to access items from others inappropriately. We can try to limit the motivation to inappropriately access items, right, through different means of reinforcement and extinction and maybe punishment. But can we truly eliminate all motivation? Well, that's hard to say, right? And especially through this intervention, even if we're teaching them a more functional way to communicate, it doesn't mean their motivation to grab items is just going to go away. D, to teach the client vocabulary words unrelated to problem behavior. Well, everything we're teaching them here is directly related to the issue at hand. We're trying to teach them a better way to get things they need instead of grabbing items without asking. So the primary goal here is to teach a socially appropriate replacement behavior. You're implementing extinction for a client screaming behavior that was previously reinforced by gaining access to toys. In the first extinction session, the client screams louder and longer than ever before and also begins hitting the table, which is a new behavior. You continue to withhold the toys. What phenomenon are you observing and what should you do? There's going to be a lot of times when you as an RBT will have to make decisions in the moment. And I know we always talk about we have to reach out to supervisors and we always have to communicate, and that is true. But still, there are times where that might not be an option, they may not be available, and you're just going to have to react in the moment. So you've got to start to get better as an RBT and develop those skills. Now, if we're using extinction, what can we expect? We can expect extinction burst, we can expect increases in behavior, and this is what happens here. We put screaming on extinction, and what happens? They screams louder and longer and they start hitting the table. Increase in the target behavior, emotional responses, aggression, all of these things are expected from extinction burst, and we have to be prepared for them prior to starting extinction. Now, you continue to withhold the toys. So what phenomenon are you seeing, and what should you do? A, this is spontaneous recovery. Provide the toy briefly, then continue extinction. Spontaneous recovery occurs after extinction is over, right? We're still in the midst of extinction, okay? Once extinction is completed, then we need to look out for spontaneous recovery. We're still using extinction. B, this is an extinction burst with response variation. Continue the extinction procedure and document the new behavior. Sure, we're looking at an extinction burst, and we want to continue the extinction procedure because the extinction burst is usually a good sign that extinction is actually working. C, this means extinction is not working. Switch to a different intervention with guidance. Well, the extinction burst signals to us that it's likely our extinction phase is working. Switching to a different intervention in the midst of an extinction burst is not a good idea. We have to plan for the extinction burst and be ready for it. D, this is behavioral contrast. Implement the procedure only in certain settings. Behavioral contrast is when, for example, we have behaviors in two settings. We change something in one setting that increases or decreases the behavior. We don't in the other, and the behavior goes the opposite way. We're not talking about multiple environments here where the behavior is going in different directions. We're talking about extinction for a behavior, which leads to more of that behavior or an extinction burst. We need to continue that procedure, document the new behavior. You arrive at a client's home for a scheduled 2-hour ABA session. 15 minutes into the session, the parent tells you they need to run to the store quickly and will be back in about 30 minutes. They ask if you can continue the session while they're gone. You're alone with the client and the parent leaves before you can fully respond. What should you do? This is a difficult situation, right? Obviously, you cannot be alone with the client without a guardian present, and you're not a babysitter. So if you're in a situation here and the parent is leaving, then obviously the best thing you want to do is try to tell them, I cannot be alone with this client. But in this case, what happens? Well, they tell you they're going to the store and they ask if you can continue while they're gone. But before you can respond, they already leave. So you can't abandon the client, but you're also in a situation that you really shouldn't be in. Here we're looking for a best answer, right? There's no great thing, but what's the best thing? A, continue the session as planned since the parent will return soon and you're already there. We need to stop session, right? Now everything needs to pause while you keep this client and yourself in a safe position. B, in the session immediately and leave the home since you cannot be alone with the client. Well, you can't leave the client alone either, so that's not an option. C, contact the parent and tell them you cannot be in the house without a guardian present. This is the best answer. There's no good thing here because you're in a tough spot, but you need to contact them and let them know you cannot be home alone. Call them, text them, whatever you have to do. Don't abandon the client, don't continue session, but reach out to the parent until you can get in touch with them and tell them you cannot be in the house alone. D, continue the session but document the parent was not present. Tough situation, difficult situation, right? Whatever you want to say, you have to do the best thing here. And with the options you're given, you're limited. You have to try to get in touch with that parent and tell them you cannot be in the house without a guardian present. You're working with a client who has difficulty with transitions between activities and often engages in problem behavior when routines change unexpectedly. Your supervisor recommends implementing a visual schedule that shows the sequence of activities for each session. After implementing the visual schedule consistently, transition-related problem behaviors decrease. What function is the visual schedule serving? What function is the visual schedule serving? In other words, what is the purpose of the visual schedule in this intervention? You have a client, they don't transition well, and now you're going to use a visual schedule to show the sequence of activities. Transition-related problem behaviors decrease because of this. So what are you trying to do? Are you trying to prevent a behavior or react to it? And you have to ask yourself that. If you're preventative, you're more of an antecedent intervention. If it's reactive, it's more of a consequence. With a visual schedule showing sequence of activities, trying to prevent the problem behavior before it happens, this is more of an antecedent, right? So really, the visual schedule is acting as an antecedent intervention before the problem behavior even occurs. B, the visual schedule is a reinforcer for completing activities. Well, it's not a consequence. You're showing them the sequence of activities prior to the transition. So since you're not reacting to the problem behavior, it's an antecedent. So it can't be a reinforcer and it can't be punishment and it can be extinction because it's not a consequence, right? It's an antecedent to the problem behavior that you're working to use or using to reduce or try to prevent the behavior from happening. So in this case, the visual schedule is an antecedent intervention. All right, thanks for watching. Check out btexamreview.com for all of our study materials. When you pass, let us know so we can include you in the Sunday shout-out. Work hard, study hard. See you soon.